Vermont Democratic Senator Peter Welch joins us now. Senator, good to see you. You know this is true. All shutdowns end, and when they do, voters in America are left to decide and separate the victor from the vanquished. How does this end, and who's going to be the victor and who's going to be vanquished?
Well, first of all, what's it about? Number one, I don't like shutdowns, and the reason we're at a shutdown is about health care. And it's also about the president telling Republicans not to talk to Democrats at all to resolve our policy differences. But at the heart of this is a very, very serious issue, and it's whether we're going to maintain the Affordable Care Act support for the millions of Americans who depend on it. And I want to step back a minute. I think this is important. In the first Trump administration, their goal was to repeal Obamacare. They tried on votes 60 times in the House, ultimately succeeded. But it was that famous, wonderful John McCain thumbs down vote in the Senate that saved it. The Obamacare survived, but in Trump, too, they don't talk about it, but they're succeeding in doing it. That's what is so alarming. The one big, beautiful bill, 15 million people are going to lose health care over 10 years. And now, with the lapse of the Affordable Care subsidies, working folks who pay for their health care with some taxpayer support are going to face premium increases in a place like Vermont of like $15,000 to $20,000 a year. That's what this is about for us.
I want to read to you a comment that your colleague from Nevada, Catherine Cortez Masto, gave to National Public Radio in this context. She said, "I don't believe in this idea that we have to harm some Americans to solve problems for others," meaning she's uncomfortable with this shutdown strategy pursued by the Democratic Senate leadership. Agree or disagree?
Well, I agree. No, I agree with her. I mean, she's got a point. There are no winners here. But here's the situation, here's the choice we face. Do we want to appease Trump, where there's overwhelming evidence, and that's just by buckling to him, that there's no end to what he'll demand, or do we want a shutdown? The fact is we want neither, but, you know, Catherine made her choice, and for really good reasons. I made my choice, and it's about the only leverage we have to protect Americans' health care is by making our point here. So that's what is at stake here. It's the health care. And by the way, the president, number one, told Republicans don't talk to Democrats. In the past, presidents, Republican or Democrat, have been the convener-in-chief, forcing the parties in a room to work out the differences. It's the opposite here. Second, we just saw the extraordinary vindictiveness of the president, where he took away about $8 billion in funding that went to states on the basis of the fact that those states did not vote for him in the presidential race. That's unheard of. So we are dealing with an executive who is willful and whose goal since Trump won has been to get rid of the health care that we passed during President Obama's time.
To that point, Senator Welch, the president has made it clear this week that the longer the shutdown goes, the more he will lay off or fire, not lay off, fire federal workers and close down programs he believes specifically benefit Democrats. Are you not fearful of that consequence?
You know, I'm absolutely fearful of it, but I'm absolutely appalled by it as well. We have a policy difference. He's entitled to fight for his position on health care. And why doesn't he come out from behind the lectern and say to America, you know what, you're on your own when it comes to health care. So he can take an explicit position, but when he's abusing the power of his office to take away funding for Vermont because Vermont voted for his opponent, or Illinois, he's hurting individual American citizens who have no say in this. I think it's pretty appalling abuse of power.
It has been said by many privately today, Senator, that votes tomorrow will be very indicative of the duration of this shutdown. If there's no cracking among Senate Democrats, Republicans and Democrats I've talked to and our colleagues at CBS have talked to say this thing could go on for a week, if not longer. True?
Well, I hope not. The bottom line here is, when I was on the floor and we had some informal discussions, there were a number of Republicans who understood the merits of our concern about extending the tax credits in the Affordable Care Act. And the reason they do is because what I just described, a Vermonter getting a $15,000 increase in their premiums or $20,000, that's going to happen in their states as well. So this threat of essentially collapsing the Affordable Care Act support is going to hurt folks in red states and in blue states. And a lot of my Republican colleagues understand that. And that gave me some confidence that at least the members of the Senate can have an opportunity to discuss a way forward. Now, Trump is making it harder. Number one, he doesn't want a deal. And he has been fighting to get rid of health care for 2 terms. And number two, he's not playing the constructive role that usually is the one that a president does. So tough days ahead, but this is a fight worth having about protecting health care for Americans.
Democratic Senator Peter Welch from Vermont. I appreciate the time, sir. Thank you.
Thank you.